Consider for a moment Jamie, a talented veterinarian who is working long hours at her new clinic. The clinic is experiencing a big influx of new patients this year, keeping the staff extremely busy. Most people are working overtime and are exhausted. Employees recently completed an employee survey and were honest about feeling burned out. In response, the Human Resources team decided to launch training to improve employee wellness. They sent Jamie and her team members a link to a mandatory online 4-hour resilience training. Jamie was told she had a week to complete the training, even though she had no time during work hours. Despite being depleted of energy by the end of the work week, Jamie had to finish the training over the weekend to meet the deadline. If you were Jamie, how would you feel? Would you feel heard by HR or frustrated? Do you think this solution would work? If you think this solution seems unreasonable and unhelpful, you aren't alone. Unfortunately, this is based on a true story, and the real-life Jamie, study participants' names have been changed throughout the book to protect confidentiality, felt extremely frustrated. The training felt like a quick check-the-box solution and didn't provide the real help clinic employees needed. In fact, in some ways, Jamie felt like the training made her wellness worse. She wasn't able to fully disconnect from work over the weekend. Instead, she had to devote 4 hours of her recovery time to even more work. This story is just one of many. You probably have your own examples of wellness programs implemented at work that felt more like insults than solutions. Stories like Jamie's led us to write this book. We heard clients, friends, and colleagues complaining about stress at work, burnout, and the resulting impact on their companies, jobs, and well-being. No one seemed to know how to solve the problem. So we embarked on a hunt for the answers. We dug into the research, searching for concrete guidance to help. Although we found some great science that we will share throughout the book, there were still some unanswered questions. Even more concerning, there was no clear roadmap to follow to create a thriving work environment. Thus, we stepped in to bridge that gap. At the heart of our research, we found that there's a mismatch between how employees and organizations define the term wellness. Consider what wellness means to you. We asked this simple question to dozens of employees and got a range of responses, from a feeling of balance to being seen as a whole person to being able to turn the Zoom camera off and take a walk during a meeting. But one theme rang true throughout the data we gathered. Wellness is not an initiative or a program. Instead, we learned that wellness is improved when employees' day-to-day work conditions support their health and happiness, not a surface-level approach for addressing an otherwise stressful or overwhelming work environment.